Vaccines are very safe. If someone gets sick after vaccination, it is usually either a coincidence, an error in administering the vaccine, or very rarely a problem with the vaccine itself. That's why we have vaccine safety systems. Robust vaccine safety systems allow health workers and experts to react immediately to any problems that may arise. They can examine the problem rigorously and scientifically, look at the data, and then promptly address the problem. WHO works closely with countries to make sure that vaccines can do what they do best, prevent disease without risks. New vaccines against malaria, meningitis, and encephalitis in Asia and Africa are now being thoroughly monitored with support from WHO. Vaccines are one of the safest tools we have to prevent disease and ensure a healthy future for all children. I think we cannot overemphasize the fact that we really don't have very good safety monitoring systems in many countries, and this adds to the miscommunication and the misapprehensions because we're not able to give clear-cut answers when people ask questions about the deaths that have occurred due to a particular vaccine, and this always gets blown up in the media. One should be able to give a very factual account of what exactly has happened and what the cause of deaths are. But in most cases, there's some obfuscation at that level, and therefore there's less and less trust then in the system.
I cast back my mind to our situation in Nigeria, where at 6 weeks, 10 weeks, 14 weeks, a child is being given different antigens from different companies. And these vaccines have different adjuvants, different preservatives, and so on. Something crosses my mind. Is there a possibility of these adjuvants, preservatives, cross-reacting amongst themselves? Have there ever been a study on the possibility of cross-reactions from the panel members that you can share the experience with us?
The other thing that's a trend and an issue is not just confidence in providers, but confidence of healthcare providers. We have a very wobbly health professional frontline that is starting to question vaccines and the safety of vaccines. When the frontline professionals are starting to question, or they don't feel like they have enough confidence about the safety to stand up to it to the person asking them the questions. I mean, most medical school curriculums, even nursing curriculums, I mean, in medical school, you're lucky if you have a half day on vaccines, never mind keeping up to date with all this.